Okay, we're going to get started. And for those of us who join later, they will be able to join in if we have moved on to small groups. So welcome back. Today we are closing out this 4-part workshop series. And today's focus will be on testing and prototyping your ideas without being in person. Again, my name is Liz. I serve as the design thinking lead at Innovate Carolina and look forward to working with many of you in the next couple of weeks and months as we get ready for the Fall Faculty Innovation Workshop. So as a reminder, we are previewing some of the content that we will go further in depth this fall. So to start, this workshop series was meant to build faculty knowledge and skills in design thinking, to begin fostering community across faculty around campus, and then also to connect faculty with innovation and entrepreneurship experts and resources here at UNC, specifically at Innovate Carolina. And for this particular workshop, we will be discussing the importance of prototyping early and often, providing concrete strategies for how you can prototype or test ideas virtually, and continue to facilitate individual reflection. In terms of announcements, I saw in the feedback from Monday's session that many of you have questions about what happens after this 4th workshop. And so want to say here that while today is our last workshop for this series, we are planning on engaging with you in the coming weeks and months. And the best way for you to tell us how to best support you is to fill out what we're calling the roadmap form, which we'll send out after today. It's a very short questionnaire, but it gauges where you are and what support you're looking for. So our Innovate Carolina team can customize support that fits your needs. As a reminder, please turn on your video, especially for small groups, and then continue to type into the chat or unmute yourself to ask questions as we go. So for today's warm-up, we are going to do something called Care Package. A lot of the warm-ups that we've been drawing from are actually from IDEO's travel pack. And so this is something you can order off their website or from Amazon, but it's a handy dandy group of cards that comes with different methods and activities for you to do for each of the 3 design phases. So for this particular activity, sometimes it's helpful to give people a chance to explain their priorities, their values in their own words by inviting them to create a care package for a specific purpose. It's also a great way to learn more about people. And so individually, for the next 2 minutes, I'd like you to imagine you're moving to a new country alone where you don't know the language. What would you take? So again, in the next 2 minutes, imagine you're moving to a new country alone where you don't know the language. What would you take?
Do you want us to put this in the chat or just take notes?
Just take notes. We're going to switch into small groups soon, so you'll be able to share. Just keep it to yourself for now. One more minute. All right, so similar to how we've been doing it the last few times, I'm going to push you into small breakout rooms and hope that, again, you're going to meet new people that you haven't interacted with yet. You will introduce yourself to fellow workshop participants by including your first name, department and school, and then one or more items you would take to the new country with you and why. And so I'm going to give you all 8 minutes to do this. There should be about 3 to 4 participants per room, so about 1 to 2 minutes per person. And I will see you back in 8 minutes. All right, looks like half of you are back. Okay, so as a reminder, we like to do warm-ups at the beginning of team meetings or anytime you are trying to get to know people better. And so this one is great whether you're trying to get to know a new team or to get to better know your team members, or if you are working with end users and trying to understand, you can create situations and ask them. For instance, for the task force work I was doing with childcare during COVID for UNC Health, we did a similar activity with parents who are also UNC Health employees and asked them to create care packages that they would send with their children to child care centers, just to figure out what parents felt was important for their children. And so hoping that this builds a set of examples of how you could do warm-ups in future meetings. And so for the rest of the time today, we will continue to discuss design thinking and specifically the third phase of implementation. And so I will do a quick review of design thinking, go through implementation basics, and then couch it in the case study of our Real Talk app in my work with teens. I will provide some tips for virtual implementation, and then we will end focusing on ethics and design thinking. And so, as always, if you have questions, feel free to type them into the chat and we will start. So many of you have been on the sessions the last couple of days, and so know that you've seen this content. According to IDEO and IDEO.org, design thinking is a human-centered approach to problem solving and innovation. And what we like about design thinking is that it explicitly asks us to consider 3 different aspects of innovation: desirability, feasibility, and the business viability, and trying to triangulate the sweet spot in between to design solutions. Design thinking comes in many flavors. Again, we're working with IDEO's version, and it's a set of mindsets, a method and a process, and a set of tools and activities. For the mindsets, you've seen this already. The big ones are creative confidence, the fact that creativity is something that can be practiced and coached to increase confidence. And overall, design thinking is optimistic and hinges on multiple iterations of different ideas and solutions, and therefore failing as you go so that you can create something that really will stick in the real world. So the simplified version of the process starts with inspiration, getting to know your users, better understanding the context and the different aspects of the problems before you try any sort of problem solving. Then we go into ideation, which was Monday's workshop, thinking about divergent and convergent thinking, so creating and making choices. And then today we're ending with implementation. So now you have some ideas. How do you move forward and test it and make it real so that it can become an actual solution in the real world? Tools. Many of you have been doing the online forum posts, and so familiarizing yourself with the different methods according to IDEO's design kit. And so there are specific activities with instructions and time markers and examples included in the field guide. So we encourage you to keep looking at them for inspiration. And then lastly, design thinking versus traditional problem solving. Again, typically we take the information that we receive and from that information, move forward with the solution. Design thinking very explicitly asks us to pause, go backwards, do more homework to try to better understand the problem and the people, unearth some more information and potentially some more problems before moving forward with generating multiple solutions. So at this point, we're going to return to the case study that I was using in the second workshop focused on inspiration with Real Talk. So this is my own work working with teens ages 13 to 15 to increase their access to comprehensive sex ed. And so the purpose of the implementation phase is to turn your ideas into reality and to test them in the real world. Here are a few of the big methods for this particular phase. One, rapid prototyping. And so making sure that you spend the majority of the time testing low-cost basic prototypes first, enough so that you can essentially calibrate what it is that you are going to be creating. And so at the beginning, you might have many ideas and they're all really different. Testing those different ideas up front quickly will then hone in over time on a more refined idea. Next, define your indicators. And so many of us, especially as we're applying for grants, are asked to think about what are the SMART objectives and the long-term outcomes at the very end of this project. Defining your indicators asks you to think about in the near term, so in the next couple of days and weeks, what would you expect to see? And what is that threshold that says you're on the right track, or, ooh, this isn't going as well and we need to adjust? And then live prototyping and piloting. And so making sure that you are engaging with real users and mimicking real world conditions as best as possible to watch people use your product and to gather data. So with my Real Talk work, at the end of our inspiration phase, interviewing teens and parents and health education experts, we learned that schools are not a preferred place for young people to learn about sex and relationships. We learned that teens care about privacy, source credibility, and safety. We heard from teens that they get their info about sex and relationships from peers, Google, and porn, and that they prefer to use their smartphones instead of computers to access Google and porn. So after that, we went through an ideation phase with a bunch of the different IDEO methods. And after those different methods, we unearthed that teens want to know that they're not alone. That's something that was consistently, that we were consistently hearing. Teens want to read stories and not facts. They were tired of being handed statistics and not being able to contextualize all those numbers. Teens wanted to read text message combos instead of prose, and they liked reading stories from different perspectives, and they defined perspectives very broadly. And so once we had that information, we started our implementation phase. And with rapid prototyping, we went through many, many different ideas. And so starting at the beginning, we used PowerPoint and copied and pasted blank cell phone screens, like you can see in the top right of this slide. And then we created shapes and used text boxes to go through to create mock-ups that we could put in front of young people and ask them questions. And so this is a free prototype because we did it within the matter of minutes. It's lower fidelity, or in other words, there's basic visual design, content, and interactivity. And so you can't click or do anything fancy with these static images, but they're good enough to ask some very basic questions about, if you went to this app and saw this first screen, what do you think would happen? What do you think the purpose of this app is? If I click explore, what do you think that next page would be? So after we did a couple rounds of that kind of testing, we then transitioned from the static testing to clickable wireframes in Vision. And so there's technology out there to create higher fidelity prototypes. So prototypes that are more complex and realistic visually with regards to content and interactivity. And then we designed experiments to answer questions over a period of a couple days or a couple weeks so that we could iteratively collect information and then use those data to make informed decisions. So for example, one of the ways that we rapidly prototyped was use Typeform. And so a lot of us have access to Qualtrics. Qualtrics is great and it's secure and has a lot of other features. It is not the prettiest. And so working with teens, we realized that things had to look really nice, and Typeform is a survey builder, just like SurveyMonkey and others, that does make really pretty things, both on phone and websites. And so some of the things that we asked young people were, here are 3 different options for the same type of screen, like which of these home screens do you like best? They'd pick one and then we'd follow up with why. So here are some of the examples of prototyping that we did. Similarly, use Typeform to test some options. For example, we were curious about what young people would use the search bar in an app to search for if we were to build one. And so we mocked up this screen. They couldn't do anything yet, they just saw it, and then looked at the screen to the right, type 5 more things you want to search for in the Real Talk app, just so we could start to see what it is that they might be searching for. And then we heard from young people time and time again that they wanted to read stories and not facts from other people, to learn about other teens' experiences with relationships and puberty. So we knew at some point we'd have to be able to collect stories. And instead of starting and building the tech in an app to do this, we started with a Google form that we put on our website and directed young people to our website by texting it to them. And so we asked them prompts and then gave them an open text box to type in their stories. They answered some demographic questions and submitted it. And so we were explicitly testing whether teens would be willing to write and submit stories to third parties if they didn't know who we were. And then also the quality of those stories, what percentage of them were actually good enough that we would consider publishing. And then another example of prototyping. So we also wanted to understand more about why people submitted stories to us. And so again, we went back to Typeform and texted out a link to a survey. This one asked questions like, why did you submit a story to the app? And here were some of the responses we received. Because I felt that real stories from real teens can be more effective in helping than an article made by adults who haven't had the lived experience. I wanted to help people like me going through the same situation, because I wanted to let out how I felt and see what other people thought about my situation. And so it was really helpful for us to engage in this way in these early stages where we haven't actually built any tech, to ask questions and to put ideas out there and have young people react to them. So at this point, we're gonna go with the face mask example, because many of us are thinking about the reopening of campus this fall. And so your turn, let's pretend that you are part of a group designing masks for faculty to wear as they teach in person this fall. So we've partnered with Be a Makerspace on campus to create some prototypes and want to try them out with other UNC faculty members. And I have done a quick Google search and picked out 3 different types of masks. The first one has this knitted version with a filter sewed into the back. The second one is the one with the plastic cutout so that you are able to read lips or to see people's mouth as they're talking. And then the third one is a more typical one, going behind the ears. And so as a whole group, want us to think through some of these questions. And so inviting those of you who would prefer to unmute yourself to participate, that would be great, or feel free to type into the chat. But this first question, so great, we have these masks, they're built somewhere. How might we recruit faculty to prototype and test out these different options?
This is Maureen. At the School of Government, we do training year-round with lots of different folks, from traditional students to folks in the field. I would use sort of my social capital networks to go out and say, would anybody be willing to try these different masks? You'll randomly be given one to teach with. And could we evaluate, talk to the students afterwards and do a quick poll everywhere evaluation to get reactions? Getting them, you can just mail them, might be actually the fastest. And yeah, I would just ask them to teach a single session with their mask and then get student feedback.
Thanks, Maureen. Other people want to add to Maureen's thoughts in terms of how you might recruit faculty to prototype?
I think, Natalia, I think I would go to faculty that are already using it. Like, for example, maybe nurses. Well, I'm from the School of Nursing, but nurses, doctors, people who are already engaged in using masks. So maybe they wouldn't mind to kind of try other styles and actually they need it. Maybe I would go to them first because I think it will be easier to get those first. And then, I ask them also, recommendations for how to attract other people to use it.
Thanks, Natalia. I also see in the chat, so Kate, Arcot, and Leslie are all thinking that we might want to send all 3 options to the same faculty so that they can compare the different options. I see Kate is talking about making sure that we recruit a variety of faculty in terms of levels of teaching, type of teaching, and perspectives about coming back to campus. So touching on that extreme users maybe, so just making sure that we're capturing a wide group of faculty. Leslie would want to know that these masks were vetted by infectious disease experts, and in the immediate future, instead of waiting till the fall to test these, if we're trying to do this now, asking people who are already teaching summer classes. And then Maureen, great question. Is the goal to evaluate from the perspective of faculty or the students? And so at this point, we're going to recruit faculty because they're the ones wearing it, but ultimately you would want to prototype and ask questions of the students because it's great to protect the faculty. It is also probably really important for the teaching experience to understand if some of these masks are better on the receiving end from a student perspective. Thank you. Okay, so the next method that we're going to cover through the case study is defining your indicators. And so again, many of us are accustomed to thinking longer term, and this is what we're hoping for type objectives or goals for the research and the teaching that we do. When we talk about indicators, we're definitely talking short term, and I want you all to think of indicators as sort of litmus tests. And so for those of you who might have had pH strips for fish tanks or other chemistry backgrounds, something that you could quickly assess if you're on the right track or not. And so ask yourself, what's the critical threshold? If you meet this particular objective, you're okay. But if you don't hit the objective, it's telling you that you need to adjust somewhere. And so I'm going to give you some of the ones that we use for our Real Talk case study. And so very quickly, young people gravitated towards the idea of having a mobile app. And so we knew that based on everything in inspiration, ideation, that we would have to be able to collect stories, share stories so that our users could read stories. And we were considering whether we wanted to spend the money and build a search bar. And so as we were testing, we had key performance indicators and then objectives that we wanted to hit. And again, these are the near-term thresholds where we told ourselves, okay, if we don't hit these or exceed them, then something's wrong. And we need to really think about either changing the design of whatever it is or whether we really need that particular feature. And so the first one, % of users who read 3 or more stories in the first visit. So we wanted to make sure that if people are coming to our actual app, that they are engaging in the content we want them to see. So we set an objective for 50%. We wanted at least 20% of users who or part of our app to submit a story, we wanted at least 20% of the stories that were submitted to be publishable, and at least 50% of the users who use our app to use the search bar. And so in terms of how we actually went through and tracked these, we used Google Sheets and created a tracker for ourselves. And this is where we grouped some of these KPIs into different categories. So for user experience or engagement, others were related to content. Again, we would go through and provide objectives. And then if we had baseline data, we would include baseline data. And then every quarter or every set of experiments, we would go through into color code, with red being didn't meet, green being exceeded, and then the yellow being either close enough or right at the objective, so that we could hold ourselves accountable to making sure that we were tracking the progress of these indicators and not just saying that we were going to be doing them. And then Maureen, I see this, yep, if you exceeded it, we exceeded it, but I think that we gave ourselves a couple percentage points around for that yellow category. But really, if we were significantly under, then that was concerning for us. Okay, so again, going back to the example where we are part of a team that's testing these 3 types of face masks with faculty teaching in the fall. Let's think through what some of these key performance indicators might be and some objectives. And so I'm going to go back to the chat to see if anybody specifically started. Great, looks like people started. Leslie at least started. So do they stay in place during the teaching? Is the user comfortable wearing it? And so I can edit this. So comfort level, and we could come up with, based on 5-item survey, and we could say that we would like at least 50% of people to report like average or above average comfort level. Okay, what are some other things? And again, I know that this is quick, just trying to make sure that we have some ideas about how we could apply this. I see, do they fog up your glasses? Does the clear pane plastic stay clear or fog? Communication performance. Do you at times forget you have the mask on? How long does that take? How well can people understand your speech tone? Okay, durability performance. So I'm going to just take a couple of these. Durability performance, comprehension from reported by students. Okay. And then I'm going to keep it here, even though I know that more people are typing in. And so for the durability performance, I think that we could provide items again with Likert scale options, and then you could report or hope that at least 50% report that they agree or strongly agree about durability. And then in terms of comprehension reported by students, at what point would it be problematic? And so not necessarily the goal, but it would be personally, if it was fewer than 70% reporting that they could comprehend faculty, I think that that would be a critical threshold. Like ideally 100% of them would report that they could comprehend, but if it's anything lower than 70, I think that we would potentially think about that potential mask option. Yeah, and I see convenience, sizing. I agree. So many of these things are things that you could ask about. But again, the key thing here is that you are looking for not what you're striving for, but if you're not hitting this 50%, 50%, or 70%, or whatever numbers you set, then we really need to think about the actual masks themselves. And it's possible that if you give all of these faculty members the same masks, you can compare these numbers across the 3 different masks to help inform your decision. Yeah, Leslie, I see how well do the masks either help or inhibit people with disabilities from understanding? Okay, so after you go through a couple rounds of prototyping with those lower fidelity prototypes that either you create by drawing in Microsoft Word or PowerPoint, and then maybe you advance to something that either looks or functions more like the solution that you're envisioning. You can then step it up to a live prototype. And for us, we went through many of those clickable versions and PowerPoints, and then we got to a point where we felt confident that we could hire somebody to build us a website that looked like an app when you pulled it up on a phone. And it's much cheaper to ask somebody to build a website that looks like an app than it is to build a native app. And so that's why we spent time with this version of the prototype. And so during live prototyping, we watched teens in person use the app and followed up with some probing questions. And then afterwards collected data on the back end that we could track to also see how they did with the objectives that we were hoping to get for those indicators. And on the right-hand side here is just a screenshot of the website. And again, showing that it really does render like an app, and that was intentional by design. And then once we get through many iterations of the web prototype and we were really confident that this was the version that we were ultimately going to turn into an actual native app, we did, before we made the jump to hire people to build the tech, ask teens to use the app not just once and in front of us, but ask them to use it as much or as little as they wanted to over a course of 5 to 7 days. And we would text them questions throughout their experience, asking them different things, and then also tracking data on the back end. And so, for example, some of the things that we were able to track on the back end after we asked a group of teens to use the app for 5 to 7 days, we looked back and saw that the average user session lasted almost 5 minutes. And for those of you who don't work in this space, that's actually quite high for young people to be engaged in an app. The industry average is much lower at the 1 to 2 minute mark. Most sessions occurred after school and before bed, and that was important for us to know as we figured out when to time posting new content. And so that was just helpful for us to know. Users viewed an average of 4+ stories per session, and then 30% of users used the search bar. And so again, quick examples of that version of prototyping. So as we think more about how we might prototype from a distance, especially if we don't have easy access for face-to-face interactions with potential users, first, leverage technology for creating and testing basic prototypes. And so for those of us who continue to work in the digital space, some free and low-cost options include Envision and Balsamic. So you can create things that look really nice, and if you click them, they take you to other places, which is helpful to simulate that experience. For those of us who are trying to create physical products, I know that Be a Makerspace on UNC's campus right now has been spending a lot of time and effort creating face shields and other things for COVID response on campus. And so not sure what their bandwidth will be in the next couple of weeks and months as the school year starts, but that is a great resource for those of you who want to build things yourself or learn how to do it. For those of us who might need additional support because the things that we're trying to physically build might be more technical, there are companies out there where you could send them specs or images, and then they will actually create the prototype for you, print it off in a 3D printer, and then send it back to you. So for those of you with physical products, there's some options there. And then for those of us who are working on designing experiences or interventions, we do recommend using virtual technology, including Zoom. So taking participants, if you recreate some sort of setting or experience, take them through it using video conferencing techniques, or create animated videos where you would mock up the experience, the environment, and ask them to watch the video and provide feedback. And Beyond is a great tool for those of us who aren't experts in creating animated videos, but it's clickable technology where you create characters, you set up backgrounds, you voice record, you program the motions that you want. And so it's really fun, but also a great way to create an experience or something that's a process so that people can actually see what you mean without being with you. And then in terms of how we want to collect data from users, so you can continue to engage on the phone or through video conferencing if you want to probe with questions. If you want to send quicker questions, I do recommend using Qualtrics, which we all have access to as UNC employees, Google Forms, or again, Typeform for the prettier versions of forms. And then other tips that I want to encourage: first, set deadlines for experiments or rounds of prototyping so you know when you need to make choices and move forward. It's very common that you want to keep prototyping, but at some point, probably for feasibility reasons, you are going to have to move from endless prototyping. And so it's great if you can say this week or for the next 2 weeks, here are the questions that we hope to answer, here are the indicators and objectives. And then at the end of 2 weeks, we're going to look at the data that we have and make informed choices. Just having that endpoint is very helpful. Second point, spend lots of money or spend money to build the actual solution once you've maxed out on learning with low-cost prototypes. So we know that a lot of our budgets, we would like more money than we have oftentimes. And so try to go as far as you can with those lower cost prototypes so you can learn a lot. So by the time you've built something, you're doing fewer and smaller tweaks. And then the last note here is to prototype marketing materials and training materials in addition to whatever your solution is. And so again, we touched upon this last time when we were looking at the journey maps, but it's not only about how strong your solution is. You could have the best solution, but if your marketing materials to reach and recruit real users, or your training materials for the staff who need to be able to do X, Y, and Z in order for the intervention to work, if those things aren't done well and prototyped early and often, those might be barriers for why your solution isn't doing as well as you'd hope in the real world. Okay, so at this point, I am going to open it up for some questions. And so, Leslie, you typed in question in capital letters.
Well, didn't mean a question. I just meant it's easier to ask whenever you could pause.
Yep.
So I'm at the state where it sure would be good to have a person after qualitative studies designing something and ready to move a hard copy into a website that's confirming that a website before the actual app. It sort of looked like an app on a website. But I really am hearing that I need to bring a member of the target audience, in this case it's patient, at least one, and I've had volunteers to be in part of this phase. It sounds as if things move pretty quickly. Maybe it's because you squished a time frame. How quickly are these iterations? And I'm thinking mine needs to move pretty quickly because the real pilot for research needs to happen in January. I'm thinking putting a member of the target audience, one of the people, just right as part of the team now. So that'll get away from IRB and trying to get a bunch of people, but just making them a part of the team with the prototypes. I don't know. Main question is, how long are these iterations taking?
Yeah, they can take, I would say on average for our Real Talk work, we were creating and reevaluating and setting up new experiments every 1 to 2 weeks. So we'd only give ourselves 1 to 2 weeks, set the deadline, and based on the data collected there, we would then inform the next set of questions that we wanted answered, next set of indicators, and then one again. And then I do recommend putting people who are in the end user category in decision-making roles on your actual team. So not necessarily, not in a tokenistic way, but making sure that they understand what they are able to input and make decisions on, because their voice is really important. And so, I think that that's great. And especially if you're time pressed and you might not be able to find lots of end users quickly, I do think that it's worth asking at least one of those members to join your decision-making team. But your
last question, did you keep the same people on the same? It seems to be an advantage if you're turning stuff around every few weeks. Did they stay the same users all along? I'm sorry to monopolize.
Yeah, we changed users because we didn't want to assume that if we had worked with like the same 10 or 20 that they were representative of all the other teens out there. So we made an explicit attempt to recruit diverse samples every time and then to change them every time. Maureen, did you have a follow-up question?
No, I'm
Okay.
just, and maybe you can, well, maybe not specifically to this conversation, but in general, moving forward in terms of steps after this workshop, which is having a better sense of the resources available. I find that I can easily articulate what it is I want to do, but I don't know the tools and how to find them and how to get up to speed. So it could take me longer to figure out how to do what I want to do than actually do it. So maybe that's something that Innovate Carolina can help us with.
Yes. And so to that comment, I really encourage each of you to fill out the roadmap form that will come out, because our team has spent a lot of time crafting it in a way that once you fill it out, we have a better sense of who you need to connect with so that we can customize a plan so that for you, Maureen, we'd be able to support you and connect you quickly. And so I think the best thing at this point is to recommend that each of you complete that post-workshop action steps so that we can make sure each of you is getting the efficient support that you're looking for. And then last question before I push you back into small groups, Carmina, how and when did you decide you were done with prototyping for Real Talk? Great question. And so, like I said earlier, you could prototype with no end, because nothing is going to be like perfect, and there's always room for improvement. And so that is why I think up front it's really helpful to have not only the end date for your shorter week by week prototyping experiments, but also here's the deadline for this grant or project that we're working on that we need to give specs to the developer in order for them to have time to build out this thing. And we also knew that whatever final product that we were creating was likely subject to change. Like, we knew that. And I think for those of us who practice and breathe design thinking, we know our work is never done, and that's okay. And so I think that that is something that your team will need to set, and it really probably depends on the timeline and other feasibility constraints that you have. But just know that it's okay for you to move on and commit to spending dollars to build something that's expensive, as long as you have gone through several iterations of learning that if you hadn't done, you would have missed out on those lessons learned. Yeah, and then Leslie, same thing with it's a service. And so instead of testing different like screenshots or different aspects of a physical product, it might be testing different interactions that you would have with end users. So whether it's a new clinical experience that you're trying to design for, you can essentially find ways to mimic how the human to human interactions go, whether it's through scripts and you have people read it, or you film people acting it out through role plays. But there's different ways that you could show or have end users experience pieces of it that you would then test in batches, similar to what we were discussing before. And you would set up the same indicators that you would hope to achieve, and then take your lessons learned to inform whatever version you come up with next. And so it might be a little bit different. And again, after this workshop series, those of us who further engage with you would be able to give you more specific steps. But whether it's a physical product, a tech product, or a service, you're testing pieces at a time, gathering information, and then making adjustments for future rounds of experiments. Okay, so at this point, I am gonna ask you all to reflect on a couple of questions in small groups. And so wanting to make sure that we also leave time for our discussion and content on ethics and design thinking. And so I'm going to ask you all to join your small groups again for the next 8 minutes and discuss the following questions. And I will go through and copy and paste them and broadcast them. It's actually maybe easier if I just copy them from here and type them into chat for each of you. But want you to think through when might be the next time you'll be able to prototype something in your work. How might you be able to create prototypes at low or no cost for projects that you're working on? And then how will you collect input from users who try out your prototypes? And so again, I'm going to type this into the chat so each of you has the questions before I send you into breakout rooms. And then at this point, I will push you out for 8 minutes, and then you will be asked to come back.
Cents is how much?
Okay, welcome back everybody. And so I know that 8 minutes is never enough. And I'm hoping that if you have questions at the end that you came up with as your group, that we have time to answer them. At this point though, we felt it was really important for us to talk about ethics and design thinking, especially since I think at least 15 of you have signed up for one of the upcoming Creative Reaction Lab workshops focused on how design thinking in its traditional form maintains systems of oppression. And so felt like it was important to end our time together with a critical reflection. And so in the next minute or two, if you could individually reflect on the following 2 questions. I don't need you to type it or to unmute yourself, but just to reflect on your own. What does ethical design thinking mean to you? And what does it look like in action? All right, hold those thoughts as we move forward. And so wanted to point out some of the biggest concerns that we've heard and read about the traditional versions of design thinking. So the first being only designers who are predominantly white with elite or formal training have the ability to use design thinking to design solutions. And we know that currently the only way to get training in this formal way is to pay a lot of money either to a higher education institution or to one of the design firms. Secondly, knowledge and insights are extracted from end users with little or no benefit or follow-up. And then third, designers get the easy job of suggesting solutions, but leave clients to do the hard work of actually implementing. And so ways to address some of these concerns include, first, making the design thinking process more transparent and accessible, and actually explain the process as you go with end users, and make sure you're explicit and discuss how you'll use the data and insights that you've gathered from design activities with them. Next, and we touched upon this earlier, explicitly create design teams that include end users and emphasize co-creation instead of only designers designing solutions. Third, build opportunities to increase design thinking capacity among end users. So instead of holding all of the information in our ivory tower or in these private companies, make sure that we are also building capacity in others and community members. And then, as we mentioned earlier, engage in professional development opportunities like the ones offered by Creative Reaction Lab. And then Melissa Carrier, who is on this call, and she's Innovate's Director of the Office of Social Innovation for our campus, provided the language for this slide. Empathy without humility is about you, the designer. Humility is required so that design work can be inclusive, can share power, and that we can learn from each other. It allows us to step outside of ourselves and see others in completely new ways. And so, as a moment of reflection, would like you to consider a current project you're working on. Are you the designer, or are you a design ally or co-creator for your project? What's the difference and why does it matter? So first, I'm going to ask you to reflect individually for a minute or two, and then I'll open it up for comments or reactions. All right, at this point, I welcome comments or reactions to this set of questions. It'd be great to hear from folks who we haven't heard from yet today.
I can go. I think I'm the design ally in the project I'm working on, but I think our problem is that the design team is not diverse enough, and it doesn't include enough and it doesn't include end users, enough end users.
Thanks, Marianne.
I can hop in there.
Others? Thanks, Todd.
No worries. So I'm the designer of a project that I'm working on. And I'm thinking about our design allies. And so for us, we did empathy collection, and we got a lot of feedback on the prototypes, very similar to the process you described earlier, from teachers who were we want them to be our users. And so we found some early adopters of our prototype, and we were able to kind of leverage ourselves to bring them on as like allies for our design, and we used a lot of feedback for them. And so when I think about the difference between a designer and design ally is the designer is kind of making the stuff, and then the design ally provides that feedback. And as a designer, we really have to hear their voices and embed those voices in it. And I think that's what matters, is because if you don't listen to your users, who are your design allies, especially your first ones, I think that that might create a problem for the design process, because I think, as you mentioned, it's very iterative and we need to be responsive to the information we get.
Thanks, Todd. And then in the way that we are interpreting design ally, and so it sounds like you interpret it a little bit differently, we are advocating that more of us become design allies and co-create rather than serving in the designer role all the time. I will say that many of us, especially if we are listed as PIs or co-Is, oftentimes structures are set so that we are decision-making power is given to us or expected of us. And so it will take work for us to create intentional teams, like we talked about in the first workshop, bring end users to join those teams, do a lot of the inspiration work so that we can be seen more as design allies in conjunction with end users and less as sole designers. And so with that, any other last questions or reactions based on this slide? All right. If not, wanting to end with crowdsourcing some additional ways that we might, as a group, continue to practice ethical design thinking here at UNC. And so some concrete action steps and behaviors that we could embrace include identifying lenses by which we see ourselves in the world and bring to our work, similar to the warm-up activity the first day. Document assumptions and biases we have about the people and communities impacted by our work at the beginning of the project and throughout, just to make sure that we are acknowledging that we have these assumptions and biases and checking ourselves. Next, evaluating the assumptions that we built into the metrics of success for the project with equity inclusion lenses. And so have we built in any metrics of success around equity or inclusion? Are we looking at metrics of success beyond what our grant mechanisms are asking us for? Like, what is it that is important to real people? And in the last couple of minutes before we close out, it would be great if we could offer up a couple more ways that we can continue to practical ethical design thinking as a group. And so feel free to either type them into the chat or go ahead and unmute yourself.
Hey, this is Leslie. For services we offer sometimes, and I think especially if I'm working with an underserved population who may not have insurance, I think we often make assumptions that they don't have any money at all and that, you know, there's just absolutely no way we can charge them a fee, when there has actually been research done that if they pay at least some of it, they feel more ownership into their healthcare or things like that. So I think we have to be careful what we're assuming in particular, my patients are willing to do, able to do, because that's really not letting them co-create and be part of that team of care.
Thanks, Leslie. I'm seeing comments come in. Some comments about how to really understand the benefits to end users and not making assumptions that we know what those benefits are. And so especially as we're offering incentives, to make sure that whatever it is that we're offering in exchange for their time and expertise aligns. So whether that's offering them additional training opportunities, the intervention early. I know that I'm working on a project that had to reimagine incentives right now. And so as a near-term solution, they're offering Disney Plus subscriptions for families that are working on a SNAP Ed project, because that was something that parents said that they wanted. Kate wrote, have dedicated resources, both finances and time, towards how the work and the process will include these elements, and this would look different across different projects. Leslie has some thoughts about incentives. And then Kate had, I mentioned in the small group, when students are doing their project, it's often hard to get them beyond their and my networks. And so that is very true. And at this point, especially because we want to make sure that we are engaging with real end users, I think that we do need to think through building skills about how we engage with end users. And I think as someone who will be teaching a new design thinking course in the fall, I will prioritize projects for which we have interested end user groups and for whom we have access to end users. So instead of our students making assumptions and not being able to engage with real end users, really prioritizing the projects where they can. Heather, share results with participants and invite them into the iteration process. Yep, so making that more transparent. And because we will continue this conversation in the workshop in the fall, and between now and then as well, I will keep these ideas and we can hopefully continue adding to them. And it would be great if we could put them all in one place so that those of us who do engage in design thinking work in our research, teaching, and practice, there's somewhere that we've documented how we think we can do this in a more ethical way. And so at this point, we reached the end of our 4th workshop. And as a reminder for some immediate follow-up action items, we will send out today the link to the short Innovate Carolina roadmap form. Again, it'll take 5 to 10 minutes for you to complete so that we can learn a little bit more about one or more of the projects that you think you're going to be working on in the coming months, and specifically where you're looking for additional support so we can connect you in the next couple of weeks. We will send out another survey link. We are reading each of them. And so that one, we're giving you a little bit more time. So between now and next Wednesday, the 24th, if you could spend a couple minutes, most of you are doing it under 5 minutes. And so another couple minutes filling out that last one. And then for those of you who are interested and able, please sign up for remaining office hours with our team members today through Friday. And I put the dog in the bottom right to remind myself to thank all of you for your engagement over the last 2 weeks. I know that Zoom is a new and tough format, especially to stay engaged over 1.5-hour periods of time, but I find that these fly every time I do them, and really credit you all for your participation and energy level for making that the case. And again, you have my email address, and so I will continue to update Sakai with additional resources and send professional development opportunities, but we will be in touch with each of you in the next couple of weeks after you fill out that roadmap form so that we can learn more about how to better support you. And so with that, I actually managed to leave time for questions today. It would be great to hear if anybody has any remaining questions about workshop content from today or workshop content from before. If you happen to type questions earlier that didn't get answered and you want to retype them now so I can see it at the bottom, that would be totally fine.
I just have one question. Do you have any idea when the workshop will be in the fall?
Great question, Marianne. And so we've been talking internally at Innovate Carolina, and because we know that as our individual schools try to figure out and rework schedules for classes that will be taught this fall, we are probably going to hold off on polling faculty for your availability until end of July, beginning of August, hoping that we'll know more about when we're teaching so that you can fill out that survey with confidence that your schedule isn't constantly evolving. It will not be in August. And so
No, of course not.
My gut
Yeah.
tells me it'll be in October.
So I just want to make a suggestion, and the rest of the group can vote me down, but my suggestion would be that you look at weekends too. If it's a whole day, I don't usually give up my weekends, but because of how crazy it is, it will probably be easier for me to take the time off during the week and go for something like that.
Yep, that's helpful. So we might poll you all earlier and ask if a weekday or a weekend is preferable first, and then take that information into a version that has more specific dates. Maureen, does Innovate Carolina do this for individual schools? It would be helpful to my colleagues. And so, great question. At this point, we have been, over the last 12, 18 months, building out capacity for us to offer different workshops and trainings at different school, department, project levels. And so feel free to email me to talk about what that might look like. At this point, we probably we're slotted through, I would say, close to the start of the academic year in August. And so feel free to email me with requests though, and we can talk one-on-one. All right, any other questions? All right, if not, I will stop the recording, but still stay online. So if you have any one-on-one questions, I'll be here to answer them for the next couple of minutes. Thank you all again for participating.
Thanks, Liz.